Today, we're diving into a really interesting medication for heart rhythm disorders called Propafenone. For some people, it's an absolute lifesaver. But as you'll see, it's a medication that comes with a very serious catch. It's a real double-edged sword. So let me ask you this. Imagine your heart is beating in a chaotic, even dangerous rhythm. Now, what if the very medicine designed to calm that chaos could also trigger a brand new, potentially fatal one? Well, that's the strange and, frankly, kind of scary paradox we're going to explore. So before we can really get into how Propafenone works its magic, we first have to understand the problem it's designed to fix. What exactly happens when your heart's rhythm fails? At the heart of the issue, and yeah, pun intended, is a condition called arrhythmia. And we're not just talking about a little flutter here. This is when the heart's incredibly precise electrical system just goes haywire. The beats get all irregular and out of sync, and that messes up its most important job, pumping blood efficiently. You know, this medication isn't for a minor skipped beat. It's reserved for some pretty serious stuff. We're talking about things like paroxysmal supraventricular tachycardia, which is basically a sudden, really rapid heart rate, and also the very common but still very serious atrial fibrillation, or AFib. It can even be used as a last resort for life-threatening arrhythmias that start in the heart's main pumping chambers. Okay, so how does this drug actually manage to bring order back to that chaos? That brings us to our next section, looking at exactly how Propafenone works. Medically speaking, Propafenone is what's known as a Class IC antiarrhythmic, but in much simpler terms, you can think of it as a traffic controller for your heart's electrical signals. Its main job is to block these things called sodium channels, which are basically the highways those electrical signals use to travel. What's really cool about this drug is that it has a two-pronged attack. So on one hand, you have that powerful sodium channel blockade, which dramatically slows down those electrical impulses. But then it also has this other trick up its sleeve. It acts as a weak beta blocker. This means it gently blocks the effects of adrenaline, helping to slow the heart rate down even more. It's a pretty unique one-two punch. So when you put all that together, the impact on the heart is really threefold. First, it slows down the signals. Second, it makes the heart cells take a longer rest between beats, which prevents that rapid-fire signaling. And third, it suppresses those rogue electrical triggers that can start an arrhythmia in the first place. It effectively stabilizes the whole system. But this is where our story takes a sharp turn, because every powerful tool has its dangers, and Propafenone is absolutely no exception. This brings us right to the core of our explainer, the double-edged sword. Okay, let's start with the more common, though definitely unpleasant side effects. A lot of patients report this weird metallic or bitter taste in their mouth. Dizziness, nausea, fatigue, they're all on the list too. Now, these are important to know, but they're not the main reason this drug demands so much respect and caution. This is the part that really stops you in your tracks. The FDA has its strongest possible safety alert for this whole class of drugs. It's called a black box warning. And it says that in patients who've already had a heart attack, these drugs were, quote, associated with increased mortality. That is not a warning you ever take lightly. And here's the reason why. The single most serious risk of Propafenone is a terrifying paradox called proarrhythmia. This is the potential for the drug to actually cause new arrhythmias, or make the ones you already have even worse. In the wrong patient, the cure can literally become the poison. Because of that huge risk, there are some situations where Propafenone is an absolute no-go. These are called absolute contraindications. For example, if a patient has uncontrolled heart failure, the drug can weaken the heart muscle even more. If they have certain electrical problems in the heart without a pacemaker, it could slow their heart down to a dangerous crawl. Seriously low blood pressure or a major electrolyte imbalance also puts it firmly in the do not use category. Okay, I know that sounds pretty scary. So how on earth do doctors manage these risks and use this drug safely? Well, that brings us to our final section, navigating treatment. Safety really begins with a start low and go slow approach. It's a process called titration. A doctor will never, ever start a patient on the full dose right away. Instead, they begin with a very low dose and then slowly, gradually increase it every 3 or 4 days, all while keeping the patient under close medical supervision. This gives the body time to adapt and helps keep those serious risks to a minimum.
And it's not just about the dose, you've also got to watch out for what other medications you're taking. For example, with a blood thinner like warfarin, it can crank up the effect and increase the risk of bleeding. With the heart drug digoxin, it can actually double the levels in the body, which is really dangerous. It even boosts the levels of common beta blockers and certain antidepressants. This is exactly why a complete medication review with your doctor is absolutely critical.
And look, the vigilance doesn't just stop once you've found the right dose. Nope, it's an ongoing thing. Patients need constant monitoring. This means getting regular ECGs to check the heart's electrical activity. Doctors are specifically looking for any widening of what's called the QRS complex, which shows the main heartbeat. It also means blood tests and regular checkups to watch for any signs of trouble.
So, when you step back and look at the whole picture, propafenone is, without a doubt, a potent and effective tool for the right patient. But it's a tool whose power demands immense respect, incredibly careful patient selection, and constant, careful monitoring. And really, this whole story leaves us with a huge question that goes way beyond just this one drug. It's a fundamental challenge in all of medicine. How do we, as patients and doctors, weigh the incredible promise of a powerful medicine against its very profound risks? It's a balancing act that truly defines modern healthcare.